Welcome to another exciting episode of In-Depth Eye Health podcast series brought to you by iFocus and iHub Nigeria Initiative. The series provide incredible insight into topical eye health issues and also serve as a platform for continuous professional development for eye care workers. Thank you as you listen. Hi everyone, I'm Dr. Ifi Monye. The topic of our discussion today is the environment and your eye, improving eye care safety.
Hi everyone, I'm Dr. Mustafa Bature. Our guest for today is Dr. Helen, a consultant ophthalmologist and oculoplastic surgeon with the Federal Medical Center Asaba. Thank you, Ma, for joining us.
July is Eye Injury Prevention Month. What are the different types of injuries that can affect the eye?
Thank you very much for having me. There are different forms of injuries that can affect the eye. It can affect just the eye alone or affect the eye as well as together with other parts of the body. If you talk about mechanical injury, that means something hits the eye. It could actually be an accidental injury or a non-accidental injury. For example, like you have in road traffic accidents, like you have in a stick injuries, like some people may be attacked, or like in assaults and fights, or for example, in a machete injury to the eye, or might be with a fist hitting the eye, or other forms of accident like a shoe or other objects that will hit the eye. Or during sports, you can have sports rackets, balls, toys that children play with, stones, sticks. You know, it could be something blunt hitting the eye, as I mentioned, or a sharp injury. The injury can either maybe affect just the covering, the wall of the eye, or it could actually break through and penetrate into the eye. Other forms of injury could include what we call chemical injury. This, for example, like you have an acid injury, like you have in when battery chargers work with acids, in a work situation with automobile mechanics, or you could actually have it in a home situation when you have use of acids, for example, like in vinegar, acetic acid used in the kitchen, or even things that are used in other, areas, just like nail polish, simple nail polish remover that may be used maybe in a salon or even in a home. These actually contain chemicals that can be toxic to the eye if they do get into the eye. Other chemicals like super glue. Super glue actually contains a chemical called cyanoacrylate, and it has been known to cause injury to the eye when it gets into the eye accidentally. Other chemicals like fertilizer in the agricultural industry. These contain toxic chemicals, different salts of ammonia, phosphates, sulfates, and they are toxic when they get into the eye. And people have been known to be injured with them in the work environment, in the farm. Other forms of chemicals include alkali, like you might have in the cement construction industry. Other chemicals used simply at home. For example, simple household cleaners, cleaning agents contain ammonia and sodium hypochlorite in various compositions and concentrations, and they are toxic if they should get into the eye. Other forms of injury include thermal injuries, just like having contact with burns, like you have with welders who might do their work without any form of protection, or even hot water, hot tea burns that may occur at home. So this kind of injuries could occur in different settings in the environment, at home, in the work environment, as we see in various types of presentation. Thank you very much.
That is quite a long list of injuries that can occur both at home and at workplace. How can people protect their eyes from injury both at home and in their workplaces?
Yes, emphatically so. It's important to know that many eye injuries are not outside human control. Many injuries are actually very preventable, and knowing the potential cause of injury and knowing the circumstances, the potentials that certain situations and objects have around us for causing injury, and therefore taking appropriate corrective preventive actions will go a long way to prevent injuries to the eye. For example, let's talk about the home. Many of the injuries occur actually in the kitchen, and safety in handling kitchen tools is very important. Safety in handling children's toys. Toys that children play with, they throw things and they fling things. And one of the things children should be taught is not to fling things, because many times they injure their playmates accidentally like that. Toy planes, paper planes, and they should be told, do not play with sharp objects, with sticks, with pencils, not throwing stones to play. There are games that children play. They shoot this rubber ring, rubber balls. They make it like a catapult, and they throw broomsticks and sharp missiles using the rubber band as a form of catapult. And it's a game that many children tend to enjoy. They should be strongly discouraged, because that's a very relatively common cause of injuries, in the play situation with children. Safety in handling household chemicals. I've talked about different household chemicals like bleach, super glue, vinegar. These are chemicals that may be used they have good purposes at home, but safety in handling them and not mixing them up with where they could have be wrongly used, or where you could have accidental contact with the eye. Safety in handling hot fluids, tea, hot water, to avoid burns which may affect the eye area. In the workplace, we've talked about certain kinds of injury that can occur in certain occupations. Protective eyewear, especially when dealing with dangerous chemicals, these chemicals that I had mentioned earlier, potentially explosive glass injuries. We see welders, people that deal with automobiles, mechanic, people that have to do with bottling, in the bottling sector, shops that have huge stacks of glass bottles, for sale. Sometimes you have this bottles explosion. So this knowledge of this potential is very, very important, and use of protective eyewear, goes a long way to protecting to protecting the eyes from injuries that could potentially occur in these situations. Use of protection, with people that are handling battery acid is so, so important, and care in handling it. These are injuries that we tend to see, in a common setting, from these people. In an agricultural setting, safe handling of chemicals, people that have to handle fertilizers, and the like products, should be well aware to handle them safely and to avoid any contact with the eye. Avoidance of injuries from sticks or plant stalks, is very, very greatly emphasized to avoid injuries, in the farm and agri setting. A common injury we see in the hairdressing setting, there's this stick that the hairdressers use to plait hair when they plait hair locally. And many a times you have children playing around them, and the next thing we see, we have children injuring their eyes accidentally with this. It's quite common in our local environment, and that should be strongly, emphasized, to this cater of workers to avoid this hair stick. I think there's a local name for it, but it's well known. It's a hair stick, to avoid children coming in contact with it, because it's very dangerous to the eye. Then in the school environment, children would like to play, and it's good to play. However, to avoid playing with sharp pencils, avoid throwing pencils, avoid throwing things. Children should be taught to avoid throwing things at their peers while at play. I've talked about the construction industry. There are certain chemicals, for example, lime used in cement that contains toxic chemicals like calcium hydroxide. The use of protective wear in an industrial setting, and enforcing the use of protective wear in this form of industry, goes a long way to protecting the workers from potential injury. Another very important way we can protect is the use of seat belts while driving. While use of seat belt can protect against injury to other organs of the body, is so important, also because when there's injury to other organs, to the upper body, the eye is also affected. So use of seat belts while driving, and enforcing of that by the relevant authorities, also helps to protect against potential eye injuries. And finally, we talked about non-accidental injuries in the case of assault, fighting, violence. So these are situations in which, creating a good interpersonal relation, creating good peaceful environment, and avoid triggering situations which will lead to violence in our society, will go a long way to preventing eye injuries that could occur in such non-accidental situations. Thank you.
Wow, thank you so much for all those practical tips on how we can keep our eyes safe. But how are eye injuries managed when they do occur? And are there any first aid measures that people can employ before going to the hospital when an eye injury occurs?
Okay, thank you very much for that question. It's important for us to know that eye injuries are best managed by expert eye specialists. The eye is a very small but very important organ, and a lot can go wrong in a very short time if it is poorly handled. So it's very important to know the do's and some very important don'ts which can occur, which when they occur, can have a poor outcome. So while you were asking what we can do, also what we should not do is also very, very important. So if there's an eye injured patient, the aim should be to get the person to the eye care institution as fast as possible through the fastest available means. While that is being done, as much as possible, the victim should be calmed down, and any form of good, clean cover or shield, should be put to protect the victim, or to cover the eye and protect the victim. It's important to know at that time, one of the very important don'ts is do not attempt to manipulate the eye. Whoever are the bystanders or whoever the family members, don't attempt to manipulate the eye. Like I said, the injuries are best managed by expert eye specialists. Do not attempt, if there's anything that seems to be protruding from the eye, don't attempt to remove it. Do not instill any form of medication. Do not instill, let that come as an instruction from the eye care specialist. Do not instill any form of medication, orthodox or traditional. There is no room for use of breast milk in an eye injury. There is no room for use of application of leaf. Do not apply leaf or the extract of a leaf. Do not apply urine, either human or animal urine. Do not apply any eye drops. I've mentioned that. Do not apply kerosene. Do not apply petrol. I'm emphasizing this because these are the things we have seen happening in our environment. Do not apply kerosene. Do not apply petrol. Do not apply tomato juice. Avoid any delay. This is not a situation whereby you say, put something, and if symptoms persist for 3 days, go and see your doctor. No, there's no room for that here. Fast action to take the victim to the eye care center is what is imperative. However, there are some injuries in which you have to do something while you are making arrangements to take the victim to the hospital. If the victim was involved in any form of chemical injury to the eye, that means, as I mentioned, maybe battery acid, vinegar, cement, a hair relaxer, all those chemicals that I had mentioned, bleach, household cleaner, and stuff like that, which are chemicals that are toxic. As much as possible, as it happens, please take clean water and start to irrigate the eye on the spot. Start to irrigate. That means start pouring water, over the face and over the eye. How much water? As much as you can get. If you can get a whole bucket and be pouring it by bowls, by cups and all that, as much as you can. While as you're doing that, you're making arrangements to get the victim to the hospital as soon as possible. I can't overemphasize that. Getting expert care as soon as possible makes a world of difference between having a good outcome or having a poor outcome. Thank you very much.
Thank you, ma'am, for the expert insights on this topic. It has been nice having you with us.
Thank you very much.
Thank you, ma'am.
Pleasure is mine.